You have this conversation with your child, and either through your conversation or through signs you're picking up on, you think that this is a threat that they may attempt suicide. What's your next step? What do you do?
Yeah, so if you're really concerned about them and they're saying, yeah, I have suicidal thoughts and I think about this all the time, and as a parent you're going, I have no training, I have no idea what in the world to do about it, there's a couple of things that you can do. The how to respond piece is listening attentively, not judgmentally, getting back to them on their reflecting their feelings, etc. But we need to get them help. So how do we get them help? There's a couple of different places you can go. There's some websites that have some information. You always want to try to get them connected to some sort of mental health provider.
Immediately.
Yeah, well, if you're eminently concerned about them, yes, immediately is important. So there might be a crisis center. Every county in Pennsylvania has a crisis response center that you can call. A mobile crisis may come out to their house to help them. There's a National Suicide Prevention Lifeline, which is 1-800-273-TALK or 1-800-273-8255. Parents can call that and say, I'm worried about my son or my daughter. We've been having a conversation. They're telling me this. I don't know what to do. These are folks that are trained to deal with crises over the phone. They're trained to help get you the support that you need. They can identify what are the resources in your community that you can tie yourself into. Worst case scenario, you go to an emergency room, you call 911, and you try to find another emergency method to take care of them. It's challenging. Those two things are kind of challenging because in either case you end up in an emergency room and sometimes they're not equipped to deal with psychiatric problems or what's seen as a psychiatric problem in the emergency room for kids. But they will make sure that you're getting the help that you need and get you into the treatment that you need.
If you are kind of stumped, is it okay to admit that to your kid? I'm not sure exactly what to do, but come on, we're going to look together. We're going to find something together.
Yep. No, and together is the perfect word to use for that. It's sort of this, if our kids knew how to take care of themselves, we wouldn't be having this conversation with them. But in the same vein, if they did everything we told them to do, wouldn't life be grand? It doesn't work that way either. And so the challenge is, how do we work together around this? And if you're not quite sure what to do, you can say, this sounds like it's really, really difficult for you, and it hurts me that you hurt so much. And I really want to see what we can do to help you. I'm a little bit stumped on what to do, but we're going to figure this out together. And can we do that? You almost want the kids' permission. Can we work on this together? I'll call people that I need to call. I'll speak to whomever I need to speak to make this work. I don't know exactly where to start, but I know where I can get some help initially so that they can lead me in another direction.